There's a new temporary face of the Arizona Department of Health Services now. Governor Ducey announced Don Harrington is going to take over for Dr. Kara Christ, who's been leading the health department since 2015. Harrington used to work as the department's deputy director for planning and operations. Brianna Whitney talked to him today and joins us live in the newsroom. What did he have to say about this new job, Brianna?
You know, Yetta, I had a lot of questions for Harrington about all things COVID, the direction of the department, and if he was the best person suited for this job. He says he has big shoes to fill.
A new face of Arizona's health department during a global pandemic. Don Harrington faced my questions head on, starting with COVID and the low vaccination rate in Arizona.
Do you have a different plan or approach going in to try to convince those that aren't getting vaccinated to get vaccinated? Because clearly right now it's not really working.
Well, I think our plan is to enhance the education component because a couple of things are new. First of all, the fact that Delta came along and that's thrown a new wrinkle in things, and that's made people more cognizant that it isn't going away. And I think that's improving vaccination rates. But I think also the fact that the Pfizer vaccine has been approved by the FDA, full approval. The vaccine is our #1 element in fighting this disease. It's the one thing that we can do.
Harrington has worked in operations in the department for years, but instead of just him leading, they're also bringing on Dr. Richard Carmona to head up emergency preparedness and vaccine awareness.
Why now are we splitting this job between two people? Was that for a certain reason?
Well, a large part of that is because Dr. Christ was a medical doctor and I'm not. So we needed a medical presence to kind of help us in that capacity to be that voice about vaccinations from a medical perspective.
Because you're not a doctor, why were you the best fit for this job given that Dr. Christ is a doctor?
Well, I think for the interim role, I think it's because of my familiarity with the agency and have worked entirely through the agency and with the leaders in the various departments.
And as school COVID outbreaks continue, I asked Harrington if he agrees with the governor and the new law banning mask mandates at schools.
I think it's a decision in law that they have the right to make that decision one way or the other, the parents of the children. So from that perspective, I think it's up to us to give our public health recommendations, which we do recommend masks.
I also asked Harrington what his message is to people who lost trust in the health department this past year. He says his team is passionate and dedicated to everyone's health and safety, and that what they say to the public is also what they believe themselves. Yetta?
And Brianna, as we mentioned, he is interim, but did he say anything about the areas that he would like to see improve?
You know, he did. He said he'd like to improve on the way the department presents data, especially COVID data, to make it extremely clear and easy for people to understand.
Brianna Whitney reporting. Thank you so much for the report.